So many times, cancer patients want to know why it happened to them. Could they have prevented it? In some cases, we don't do anything to cause cancer. It's in our genetics. That's why more and more people are turning to genetic testing. Soon, that testing is going to come with another reassurance: privacy. It's tonight's Women Matter.
Kind of learning how to do the eyebrows. It's a little more eyebrow.
For Joan, going to the salon is a real treat. Most of the time, she's dealing with something much more serious.
Breast cancer was the farthest thing from my mind.
Joan has stage 4 breast cancer and is at risk for ovarian cancer too.
It's just one tube of blood, so it's
She learned about the ovarian cancer risk after having a genetics test. That test showed she has a genetic mutation that increases her risk of both cancers.
I kept going over in my mind what I'd done to cause cancer in myself. And so it's like, okay, now there's a reason why I have this.
There's also a reason Joan and people like her are coming forward with their results. A new law called GINA makes it illegal for insurance companies and employers to use genetic test results against patients.
Protects the individual from this fear that somehow they might be discriminated against.
Dr. Stephen Tomei says the new law is a step in the right direction for genetic testing. He says they can test for 1,500 diseases, most commonly breast and ovarian cancer. In a lot of cases, knowing your genetic risk for cancer can help prevent it.
We're going to have less fear in the patients who need testing, and that will lead to hopefully appropriate testing in individuals who may have been reluctant to do it before, and possibly in life-saving interventions.
It's going to give you the perimeter.
Unfortunately for Joan, the test came 2 years too late. She'll undergo chemo for the rest of her life, but hopes her story will encourage others to not be afraid of learning their fate.
Had I known about this and this test, I wouldn't be in the situation I'm in now.
Well, that law, GINA, does not take effect until next year. Joan's sister, she also had that test. She had ovarian cancer and is now at high risk for breast cancer. And according to the American Cancer Society, only a small percentage of breast and ovarian cancer cases are genetic, but you can call any area genetics clinic for a consultation to see if you could be a candidate for that test. Alegent Health offers the first visit for free. You can give them a call at 1-800-ALEGENT.